Good morning or good afternoon, everyone. I hope everyone's having a good day. I'm going to be doing my presentation over the cleft palate. What is cleft palate? A cleft palate is when a baby is born with an opening in the roof of the mouth. This leaves a hole between the nose and the mouth. The definition of cleft is a fissure or an opening gap. The opening can just be in the back of the palate, the soft palate, or it can extend to the front of the palate behind the gums, the hard palate. I have some pictures that I got from our histology book. They're on page 57, figures 424 and 425. Also, a fact on cleft palate is among the most common congenital malformations. They appear 1 out of every 700 births in the white population and 1 out of 2,000 births in the African American population in the United States. Development of the palate. The palatal development happens during the weeks of 7 to 9. The bones and skin of a baby's upper jaw, nose, and mouth normally come together to form the roof of the mouth and the upper lip. A cleft happens when parts of the lip and/or palate do not fuse together completely. Cleft palates do not have to occur with a cleft lip. They can occur alone. They can extend just a short distance into the posterior and anterior of the palate, or can even occur in both. Causes of cleft palate, genetic factors, and also environmental factors. Doctors have studied cleft palate with genetic and environmental factors that influence. One study shows a high rate of family reoccurrence. The risk for cleft palate in first-degree relatives is estimated to be 32 times the risk for individuals with a family history of cleft palate. Environmental factors also are taking certain medications, such as some anti-seizure medications during pregnancy, not getting the right amount of prenatal nutrients, exposure to some chemicals during pregnancy, smoking cigarettes, using drugs, and/or drinking alcohol during pregnancy. Diagnosis of cleft palate, an ultrasound. In most cases, an ultrasound can detect cleft palate as early as 16 weeks into a pregnancy. The diagnosis is then confirmed at birth with a detailed visual and physical examination. Rarely, a baby may have a mild case of cleft palate that only involves their soft palate. This type of cleft may not show up on an ultrasound and may not be noticeable until the infant experiences difficulty feeding. At that point, a clinician will perform a comprehensive exam to identify the exact nature of the problem. I also have an ultrasound down here that shows a cleft palate in a baby. Treatment, surgical repair. A plastic surgeon brings together the separated muscles and tissue from the two halves of the palate to close the opening. A cleft palate is typically closed between the ages of 8 and 11 months before a baby makes his first attempt to talk. This is a chance between 5 and 15% that when the child gets older, the surgeons have to go back in to repair the pharyngeal flap. This occurs when the child is around 5 years old. When your patient has or had a cleft palate. Clefts can cause hearing loss, speech difficulties, and dental problems such as missing, misshaped, or irregularly aligned teeth. Children with cleft lip or cleft palate may also be at greater risk for cavities since they often have weak areas in their enamel and thicker, less effective saliva. A hygienist should take these side effects into consideration when coming up with a treatment plan for the patient. The patient should be put on a shorter recall list, proper sealants placed on the molars, and always take their medical history very seriously and use that to help with diagnosis for treatment in the dental field. And here's my reference page. I hope y'all enjoyed this presentation and it gives y'all a little bit more detail on a cleft palate. Y'all have a good day.